Good morning, everyone. Thank you so much for joining us. As you can see, we have too many people registered and participants. We are now thousands and thousands, so we've advised that everyone please watch us live on YouTube. There is a suggestion that maybe you may wish to turn your videos off because you will be muted and it may affect the quality of the discussion and the interviews. And there is no chance to chat or ask any live questions due to the large amount of people who've joined us. Also, just to note, thank you so much for all your questions. We've received hundreds and hundreds of questions in advance of this webinar that we will try to directly or indirectly answer. The importance of today and the relevance of the issue and the role of occupational safety and health worldwide to stop the pandemic, help prevent the spread, stop the lives that are being lost at work and elsewhere because of practices in places of work is today's issue of concern. We have a large number of panelists and speakers with us today. And without further ado, I'm going to introduce our ILO Chief of Branch of the Occupational Safety and Health and Inspection to give a few opening remarks. Joaquim Pintado Nunes, please go ahead.
Thank you very much, Manal. So first of all, I'd like to welcome you all to this webinar on occasion of the World Day on Safety and Health at Work. As you know, we celebrate this day every year on the 28th of April. And in a year such as this one, when we are all facing a pandemic of unprecedented dimension, of course that the theme for safety can be other than pandemics and COVID-19. So we all know that this novel coronavirus has and will have a strong impact in our lives and in the way that we work. It is difficult at this stage to know of all the longer term outcomes of COVID-19 in terms of health, in terms of societal change. What we know for sure is that occupational safety and health is crucial to face this world crisis. Without safe workplaces, it will be very difficult, and I'll say it again, it will be very difficult, if not impossible, to contain the spread of the virus, to go back into our normal lives, and to avoid further disruptions in business and in employment. So this day, we are here together, and I'm happy to see that, we have a full room, and that many people are also following YouTube. To celebrate every worker who goes to work during a health threat lockdown, because some services are indispensable. This is also the day that we think of the workers continuing to work from home, alone, or caring for children, or for the elderly, or for sick people. This is also the day that we think of all the workers, the millions of workers, namely those in the informal economy, who may struggle to follow basic hygiene measures to prevent the risk of contagion. This is also the day where we think of all the workers. So on this webinar, we will have the opportunity to hear from our distinguished panel members, representing workers, representing employers, governments, and the scientific community, their views on how COVID-19 is affecting the world of work, and what is being done or what can be done to address this challenging context through an occupational safety and health perspective. So we will start by hearing from Ms. Manal Azzi, our Safe Day coordinator, some information on what you can find on this year's Safe Day report, which is already available in the 3 languages of the ILO, so English, Spanish, and French, in our website. You just have to log in to the ILO's website, and namely to the COVID-19 webpage. The report lets us know how the international legal framework of the ILO is applicable to this pandemic. It looks into the OSH risks and protective measures directly or indirectly related to COVID-19. It looks into those professions more at risk. And it does not forget the mental health aspects of workers that are in the front line, all those whose jobs were already affected by the crisis, and also those working from home, as I suspect many of us on this webinar. So the report has a strong message in terms of encouraging all of us, international organizations, governments, employers, civil society, us practitioners, to ensure that all of our workplaces in any context are safe and healthy, and that they can, as a matter of fact, play their role in stopping this pandemic without further loss of lives. So without further delay, I'd like to introduce our panelists. So we have the pleasure of having with us representing the employers, well, the workers and the employers, Ms. Silvana Capuccio, that comes from Italy. We also have representing the employers and more specifically the senior advisor at the Federation of Enterprises in Belgium, Mr. Chris de Master. And we have also as panel members, Mr. Lord Goderis, the head, from the Lovine Center for Environment and Health, the Department of Public Health and Primary Care from Belgium. We have Mr. Richard Jones, head of Policy and Regulatory Engagement from IOS. We have Ms. Chris Lasks Davies. I hope I'm saying correctly the name. This is not the way I should refer to it. The president of the Environmental Quality Organization, co-chair of Occupational Hygiene Training Association. We have Dr. Michelle Robertson from the International Ergonomics Association, so executive director from the Office of Ergonomics Research Committee. We have also Dr. Teresita Cucueco, OIC Assistant Secretary and Concurrent Director, working from the Bureau of Working Conditions, Department of Labor and Employment from the Philippines. And I hope we already have with us also, if not, he will be joining us in some moments, Dr. Barry Kisnasamy, the head of Occupational Health, Department of Health, Ministry of Health from South Africa. So without further delays as well, I'd like to give the floor to our workers representative, Ms. Silvana Capuccio. Please, the floor is yours. Thank you.
Do you hear me? Okay, thank you, hello. And first and foremost, on behalf of the trade union movement, I'd like to express my condolences and my sympathy to all workers and their families members who lost their lives sacrificing for their communities to respond to the crisis, to the emergency. Our gratitude goes to the millions of workers around the world who continue to work, often in unsafe conditions, exposing themselves to the risk of infection. We cannot but acknowledge and thank for their invaluable contribution all the workers in the health and social care, disproportionately women, emergency services, public services, agriculture, food, retail, transport, which are often paid less than the living wage and nonetheless are proving their essential role in the social fabric. Their work is essential to save lives and provide vital products and services to those that are privileged enough to have a home and be in confinement. The virus can infect anyone. However, the risk changes based on who you are, where you live, what your condition is, your gender, if you work, where your rights, first the freedom of association, are not recognized. It has not the same impact if you do not have access to soap and water, if you live in prison, in an immigration center, in a refugee camp, in a nursing home for elderly. Altogether, yeah.
I'm sorry, I think there is an echo.
Tell me what should I do technically, and I'll do.
I think somebody has his microphone open.
But sorry to intervene. So Sorry, I think everybody who's joined us, if you can please mute your microphones and maybe remove your video.
Sorry, I was.
Silvana, please go ahead. Unmute yourself and please go ahead. Thank you. You need to, Silvana, you need to unmute yourself, please.
Okay, in such a way, it's okay. Does it work now? That's okay. So it has not the same impact if you do not have access to soap and water, if you live in prison, in an immigration center, in a refugee camp, in a nursing home for the elderly, all together, all close, all infected. It works differently if they ask you to stay at home but you do not have one, or if the one you have is not a safe place because you have a violent partner. If you live in Yemen, in Syria, Gaza, South Sudan, and war has destroyed the hospitals, houses, and facilities. The proliferation of the precarious and informal jobs, including in global supply chains, has made millions of workers even more vulnerable to the pandemic as they lack income support and social protection. The crisis has also revealed the significant coverage gaps in access to healthcare and sickness benefits, alongside an ideological retreat from essential protective legislation and enforcement and an erosion of trade union rights. The role of collective bargaining in guaranteeing the same health, wage, and job protection proved one more time to be of paramount importance to fight inequality and grant job security and protection, marking a striking difference between those workers that enjoy these fundamental rights and those who do not. COVID-19 has arrived in our countries finding unprepared health systems. Already before, the international labor movement supported the call in the ILO Centenary Declaration to include safe and healthy working conditions in the 8 ILO fundamental principles and rights at work. When can achieve it, if not now? Today, workers are still paying the highest toll of the wrong political choices made in the last decades. Years of cuts in public spending on health, austerity, privatization of public services have undermined the country's capacity to respond to the crisis. Then, if not now, when can we call for a new paradigm addressing inequalities to get a social contract as defined by the ILO Centenary Declaration, with rights of workers at its center? As in most countries, in Italy, where the human cost has been huge and terrible, there is an ongoing debate between the restriction to the freedoms and rights on one side and the right to be protected on the other. During the emergency, we went also on strike to demand that only the essential productions remain operational. And after the strike, important new agreements and protocols were negotiated at tripartite level also. In any case, nobody nowhere should propose workers the blackmailing dilemma, facing the worst possible consequences of economic and social disaster against the limitations of human and workers' rights. Never. Other choices are needed and are possible, based on a reorientation of the development model and on the redistribution of the resources, fiscal reforms, massive investments to ensure universal access systems, which are adequately staffed and workers' rights respected. COVID-19 should be recognized as an occupational disease. Work-related cases should be reported, recorded, and compensated. And the ILO should give priority to the development of a convention on protection against biological hazards, which should be a key ILO response to the pandemic. The multilateral system should engage governments and international financial institutions to give support without conditionality to developing countries to limit the impact of COVID on the assumption that the primary basic right of everyone is simply that of live and work in a safe world. On all this, the ILO has a major role to play to make the change possible through its constituency. And the workers' group is ready and will not give up to its historical role to fight for equality, justice, peace, and democracy.
So it seems there may be some technical difficulties, Joachim. We will thank you so much, Silvana. Let's move to the opening remarks from our employer representatives, Kristen Easter, Senior Advisor at the Federation of Enterprises Belgium. Please go ahead.
Yes, thank you. Thank you, Manal. Welcome to all of you, also on behalf of the International Organization of Employers. What I would like to say is that protecting lives and ensuring business continuity to protect employment are our top priority. Compliance with a double layer of regulations, one stemming from public health regulations aiming at protecting us as a population, the other, the health and safety standards at work, aimed at protecting workers and employers. We believe they go hand in hand with good business performance as well as the enhancement of productivity. The expertise and the practical guidance from the World Health Organization, the International Labour Organization, and the International Organization of Employers are key to developing any safe back to work strategy as we slowly recover from the pandemic. And those are the words of our ILO Vice President Muthuzi Mdwaba for the employers. The 2020 ILO World Day for Safety and Health at Work focuses on the outbreak of infectious diseases, particularly the COVID pandemic. We, as the International Organization of Employers, the largest global network of employer organizations, we welcome this international campaign on the importance of occupational safety and health in the effort to halt the pandemic. Protecting lives and ensuring business continuity to protect employment are a top priority for us. Since the outbreak, the IOE has been actively mobilizing its network to mitigate the impact of COVID-19, ensure business continuity and survival, and manage health and safety risks. In addition, as countries slowly and cautiously reactivate their economies and operations of non-essential services, we as IOE are working with employers' organizations and partner companies on effective guidance and good practice and action for safe back-to-work strategies at the workplace. As a matter of fact, I just spent a whole week, including the nights, developing with colleagues from the trade union in Belgium and from the government to develop our national COVID Corona guidance safe back to work. Governments and companies in different sectors of the economy which apply the principle of prevention as a top priority are better placed to navigate the crisis and implement more rapidly safe back to work strategies. The principle of prevention is therefore at the heart of occupational safety and health and at the heart of our business approach. We look forward to joining efforts with the ILO and the WHO to provide expert advice, practical guidance, and tools tailored to the needs of the different sectors for safe back-to-work strategies. Good anticipatory approaches and coordinated, impactful action are key in this endeavor. On this special occasion, the IOE reiterates employers' strong commitment to play their part in securing a safe and healthy working environment. We also encourage governments, workers, and international organizations to do their part to mitigate the impact of the pandemic on the world of work and to ensure that occupational safety and health at work is a reality for now and in the future. And I know that all of you out there, workers, employers, or as citizens, all of you are doing your utmost best to help overcome this pandemic. And no matter how small or how big your contribution, What really matters is that what you're doing is helping to keep us all safe. So thank you and stay safe.
Chris, thank you so much. Thank you so much for the workers and employers for introducing us. You are one of two of the main players in the world today in fighting this pandemic. I forgot to introduce myself, so I'm an OSH expert from the ILO, Manal Azzi, and I will just take us briefly through the report that the ILO just launched on the occasion of the World Day on this particular issue. Obviously, it's available online. Some of you may have seen it. What we tried to do, thank you to the efforts of a number of colleagues in our branch at headquarters and in the field, and a number of different departments and our constituents' support in providing examples, we were able to compile really quickly on the main issues here that we are facing. Obviously, the world has entered a new era. It's a modern pandemic that somehow we were not waiting. As Chris mentioned, the Occupational Safety and Health 101 is prevention, is eliminating at the source, and we were not able to prevent or see this coming, unfortunately. It came really quickly, it hit all the world, and it hit our workforce, and it hit our workplaces. The ILO has repeatedly discussed the impact on our economy, on our jobs. Today we're here to speak about our role as safety and health professionals, our role in the Safety and Health Committee, a community to work together with the public health efforts to help stop the pandemic. So public health and occupational safety and health, we had already started to talk as we entered into the future of work, are becoming hand in hand. The services that are provided are affecting both sides. What happens in the workplace affects communities and the other way around. So the report talks a bit about the impact on the world of work, but also discusses a bit the pandemics and how we got here, and then focuses on occupational safety and health management systems in managing the crisis we are here in today. Obviously, many enterprises and companies already have such systems and already integrated emergency planning and preparedness in them. But today we are facing a virus. To date, we do not know all the specific dimensions about the virus to be able to limit exposures and prevention, but we are following, and the advice is that all authorities, national authorities and governments need to follow closely the scientific update and the evidence on the virus and on the susceptibility of certain people to the virus and the various impacts that are happening worldwide. The report then goes on to discuss some of the risks. Obviously, the risk of contagion, the risk of transmission is one of the biggest risks that we are facing worldwide. And because most people are in work premises somewhere, somehow, be it in the formal economy, in the informal economy, in large or small enterprises, these are places where crowds and hubs of people are gathering, and infectious diseases, this is where they thrive. And so we have a huge responsibility and role to the world in limiting this pandemic. And this depends on the measures we take in the workplace. Our OSH management systems need to be adapted accordingly to assess the risks at the source and try to eliminate transmission or prevent or mitigate transmission by different ways. And so when we discuss the risk of contagion, we obviously look at our frontline workers, referred to today as the heroes of today, putting their lives out there to save our own and to save everyone's lives. And these workers have complained a lot, obviously, of a lack of personal protective equipment. They have been exposed to all sorts of psychosocial and violence and harassment because they're trying to deliver under a lot of pressure with minimal support and requirements in some countries, in some medical settings, of course. And so the report focuses a bit on these emergency and frontline workers, but also discusses general workplaces and the risk of contagion and limiting and the various control measures that one can take. It doesn't only focus on the risk of contagion. One big area that we've realized globally is the issue of stress and psychosocial risks at work, and they're becoming, you know, a real big burden on the mental health of people generally and workers. And because we are in a world where the lines between our personal lives and our work lives are intertwined, the effects and the ability to juggle all these lives in one has caused certain stresses that for some could cause post-traumatic stress disorder as we slowly move out of this pandemic, which doesn't look like it's anytime soon, but we can see the light. There are efforts to return to work, obviously it's not business as usual, it's not business as the way it was before. And as we heard earlier, different guidance and guidelines are being developed by national authorities to advise their governments and the national workplaces. Obviously, we don't forget the ergonomic risks, the physical, environmental, and chemical risks sometimes that are associated with the way we are managing this virus, with the different work arrangements that we find ourselves in, and the different sectors that are most affected. And this is affecting, and I guess with the discussion, our panelists, because I don't want to take up the floor too long, we will be able to explore some of these issues. I want to remind you all that we received a large number of questions and we will not be able to deal with them all. This is an initial webinar. Hopefully we'll have more to discuss more detail about some of these issues. The main point in the report is really that OSH practitioners, the OSH community as a whole, the involvement of workers in the discussion, the active consultation and assessment of risks and control measures need to be well negotiated, because we need sustainable measures and efforts, and we need everybody to be in on the changes that we are making. And some of them maybe are not easy to comply with, but some, we are all forced with this virus and with the limitations we have. And obviously various engineering controls, administrative controls are already being brainstormed or even implemented in some parts. And we're slowly all discovering what works and what doesn't, and what's sustainable in the long run. Without further ado, I'd like to start with our first question to our panelists. In the first question, if I could invite all the panelists to give a very brief overview of their answers, so all our audience can also become familiar with you. So we have 6 expert panelists in addition to our employer and worker experts that intervened earlier in the beginning. I understand that on live Zoom, it didn't start broadcasting directly from the beginning, but you didn't really miss too much. And so we'll go straight into the topic. So welcome again to all our panelists. Thank you for joining us from all over the world in different time zones. Obviously, this is a crisis for the world. This is also a crisis for occupational safety and health. In your view, what sort of vulnerabilities has this crisis exposed in terms of occupational safety and health and in different sectors that we are facing? If I could just get a few impressions from each of you, I'll start with Richard Jones, please. Please go ahead. You just need to remember to unmute your microphones. Richard, please.
Thank you for the reminder, Manal. Yeah, I think health and social care are the biggest issues, as well as the COVID-19. We see risks from musculoskeletal disorders, heat stress and fatigue, together with the mental stress that you've already discussed. I think from my point of view, the main vulnerabilities have included insufficient COVID-19 testing of staff and the provision of PPE. On the other hand, I think the strengths for coming out of this are the use of technology and what's termed as telemedicine. But if I look at the other end of the spectrum, in general office work, working from home can lead to issues of work-life balance and musculoskeletal problems, as well as the psychosocial risk you've already highlighted. But at the other end, it can even lead to domestic abuse. So vulnerabilities here, I think, are IT problems. It's okay relying on technology, but if you lose your internet connection, it's a big problem. And of course, cyber security is always an issue. And strengths, well, again, the use of technology for meetings. A lot of businesses would stop if there wasn't Zoom, I think. And also its use in trying to alleviate people's loneliness. So like virtual coffee morning, so people can connect with their colleagues on an informal basis.
Thank you, Richard. Chris, your first impressions on this, please. Yes.
Can you hear me, Manal?
Very well. Please go ahead.
Good. Well, it comes as no great surprise. The global pandemic requires a global response, and that really is a theme that I carry through many of my responses. In terms of a vulnerability, this is one of the few issues I've seen in the many years that I've practiced where public health issues straddle safety and health and economic issues together. So the responses are multifaceted and have taxed most traditional infrastructures everywhere around the world. Global supply chains for needed resources, education learning systems, one unitary understandable communication, which can be addressed to both communities and workers alike, local businesses which need to understand their roles and responsibilities in the face of an issue that they haven't dealt with previously, and fragmented emergency preparedness, response, and recovery systems, including business continuity plans. It's not to say that organizations don't have them, but oftentimes they're not seamless within a neighborhood or a community, and they need to be. In terms of the strength during the pandemic, well, I think it's important to understand that the global issue like this presents a risk, and I've heard it said a couple of times this morning already, it presents a risk not only to the health and safety of our communities, but it also disrupts the economic vitality of businesses, people's lives, and organizations worldwide. They're intertwined. I mean, you can't take one without addressing the other. And thus, the risk-related solutions which impact both health and economy can only be resolved with international collaborative partnerships, governments, international professional organizations, the business community, and labor working together. It's a pandemic issue. It's got to have a pandemic response.
Thank you so much, Chris, for that. I'm moving on to Michelle Robertson. Please give us your insights on the first question. Thank you so much. Please unmute. Thank you.
Thank you very much, and greetings to the world. It's nice to be able to come together to address this in a very multidisciplinary systems approach. As many of our previous speakers have already mentioned, that we have not only physical issues, but we have psychosocial issues, and how the external environment has really impacted on how we work. There is no new normal. I think the vulnerabilities is that we found that our systems have failed and are not supporting the occupational safety and health of our workers. And the employers are having to move forward and to really shift the paradigm and how they're going to have to address this issue. One of the areas of the human factors ergonomics is to take a human-centered approach. And I think these are some strategies and theories and principles that we could bring together. And again, taking a very multidisciplinary science approach will help us to address the issues. One of the strong vulnerabilities that I see with our teleworkers, as Richard has brought up, is just this lack of social connection, lack of connection with the enterprise, lack of working with my coworkers. Technology is a wonderful mediator, but you still are working in your own home environment, and all of a sudden social isolation has escalated. So these are some of the human factors issues that I will be addressing in the future questions. Thank you.
Thank you so much, Michelle. I'm moving on to Teresita, who's joining us from the Department of Labor of the Philippines. I know it's quite late for you, as it's quite early for Chris Davis. Thank you so much for joining us. If we can give us some insights on, how this pandemic has showed a lot of vulnerabilities in terms of occupational safety and health risks. Please go ahead, Teresita. Please unmute yourself. Thank you.
Okay, thank you very much. And I would like to greet you all on this Day of Safety and Health. This is the World Day for Safety and Health. In the field, definitely with the lack of a cure and no vaccine, we have to look at prevention. And that is the way where we look at reducing exposure and risk. Then that is safety and health, prevention. And this is where we are trying to put everything together so that we prevent our exposure to the disease, where we talk of simple measures of hand washing, of physical distancing, of wearing the masks. You talk of there is a new normal, and we have to adapt, because that is what is called for at this time. No cure, no vaccine, but we have ways of approaching this problem, so that we can at least look at how to prevent exposure and reduce the risk. PPEs, the issue of PPE is global. We see the lack, it's everywhere. We also have that here, but we are also trying to respond so that especially for healthcare workers that would need them, they would be provided that protection. But then we go to our workplaces and we look at how to still best reduce exposure, reduce the risk. We look at the WHO, we look at ILO, we also have to have these all. I'm from government. We have to have the national agenda. We already have the non-pharmaceutical interventions. From labor, we're dovetailing with health. We're all creating this coordinated approach, and hopefully we are trying, all of us would like to flatten that curve and eventually try to eliminate this pandemic in the best way we can. But again, minus the cure, minus the vaccine, we can always do the part to reduce the exposure and to reduce the risk. And this is safety and health. So I know this is really the way we are going to prevent this, and we really look forward to all interventions that are happening worldwide. Thank you.
Thank you so much, Teresita. As you've started to speak about, the national collaboration that you have, maybe I can jump to Dr. Barry, who's joined us from South Africa, to tell us how maybe the Ministry of Health in South Africa is coordinating with the Ministry of Labor, and what OSH vulnerabilities and opportunities are you detecting in South Africa? Thank you. Please go ahead.
Manal, it's Barry Kisnasamy, and thanks for having us on a very important day in the lives of workers, workers in communities, workers in families, and workers of the world. And so it is a critical issue. It's calling for an all of society approach to COVID-19. It's not just government, it's not just government departments, but an all of society approach. And in terms of the initial part about vulnerability, for us, there are particular issues of vulnerability in society. The first issue is the formal workforce versus the informal sector. In many of our countries, including South Africa, we have many workers in the informal economy, and often formal workers often come to the fore in terms of being able to promote and protect and prevent. But when we begin to look at the informal sector, for many of the countries in low and middle income countries, informal workforces tend to play a major role. The second issue is comorbidities. While we began to look at the issues of age and diabetes and hypertension, immunocompromised status, whether it's HIV or diseases like tuberculosis, are also major issues that affect us. It also affects the respiratory system, and these are critical issues. And work-related disorders, particularly silicosis, coal workers, pneumoconiosis, mining, etc., are also respiratory problems that could also be a major factor in terms of the process. We want to salute all health workers internationally, and particularly those who have lost their lives in the front line, almost similar to Ebola. And we're grateful in many ways that workers tend to still help in terms of the sacrifice they make, particularly health workers. The second group, of course, are essential service workers. So while many countries are in lockdown, depending on the nature of the way they have macro policy issues of government called lockdowns, and the whole issue around community screening and testing and activities in that sense, there are some workers like health workers and other workers that actually work in what we call essential services. So we also want to salute them. As we go towards a post-COVID-19 lockdown, we have to then discuss how do we actually get workplaces ready in terms of the processes of readiness of workplaces, that the workplaces don't become transmission zones. So what we've done in South Africa is to look at an entire ecosystem. We look at the worker at home, the worker in the community, the worker commuting, because transport becomes a very important issue, and lastly, the worker in the workplace. And those are very important issues as we go forward, and we need to safeguard that entire ecosystem, including supply chains. And the take-home message is plan, do not panic.
Thank you so much, Barry, also for reminding us of the numerous other safety and health risks that still exist, even if we are facing a big giant that's an infectious disease. Can I move to our last speaker, Lodi Godoris, for a few initial remarks on the first question? Please go ahead.
Thank you, Manal, and welcome to everybody. Happy I can address some questions as well as occupational health physicians. We are here to support the workers and provide advice and help to those workers that are in the front line. Work is important for health, but safe work is important to prevent occupational and work-related diseases. And that's what it's about. I think, first of all, we need to be aware that COVID-19 can be a new occupational disease, and if you cannot protect the workers, or if the workers get the COVID-19 infection, it's important to recognize and compensate the diseases. I think that's a first important issue I would like to address. Second point, I think the fact that we are working in rather uncommon conditions. We are using a lot of creams and disinfectants, which also might induce allergic skin, but also respiratory health problems. It's also important to have a look at that and to develop a protection for those workers that need to use it. And also here, the recognition of those occupational diseases is very important. And the last issue I would like to add to what the previous panelists have raised is also that we need to be aware about the impact on vulnerable, disadvantaged workers, especially those workers with disabilities. Previous pandemics and also the economic recession we can expect later on has shown that it typically exacerbates pre-existing health inequities. And I think especially for those workers, we must take supportive measures, provide them with PPEs so that they can resume safely and avoid severe health consequences, but also financial consequences due to the pandemic and also the economic recession. Thank you.
Thank you so much, Lode. We are running out of time. We did start very late. We still have a number of questions that we're going to address with each of you. I'm going to remind everyone to be as succinct now as possible, moving on so we can cover as many issues. I'd also like to inform our audience that throughout today, there are a number of national and regional webinars celebrating or commemorating workers around the world in the event of the World Safety and Health at Work. And so this is just one of these webinars, more global, and our panelists come from different parts of the world, but there are more national and regional webinars being organized globally, some led by the ILO and some led by our constituents. My next question is maybe to Richard, and I may get Barry and Teresita's input on this. We've discussed sort of the risks, the problems out there. How do we prioritize? How do governments, employers, and workers prioritize their safety and health action or response to the pandemic in this time of crisis? Richard, if you have some impressions really quickly, thank you.
Thank you, Manal. Well, pardon me. IOSH believes that health and safety is a fundamental right for all workers, as I'm sure everybody on this call does, and it must be part of any public health strategy. Decision makers need to seek advice from health and safety professionals who, after all, work across all sectors, in all sizes of organisation and in all regions of the world, so they can advise at organisational, national and international levels on setting the right health and safety priorities, not just during this crisis, but also during recovery, and ensuring that reliable information is communicated. I think, as has just been said, COVID has reminded the world that communicable diseases can be work-related, and that health and safety at work and public health are now intrinsically linked. Workplaces must be the focus for prevention, but also, sadly, they can be places of transmission unless the risks are properly managed. So to do this, IOSH advocates a systematic approach to managing health and safety, which includes, among other things, effective emergency planning, risk controls, training of staff and supply chain management, all of which health and safety professionals do on a regular basis, working with managers and workers and other professionals within their organizations. So IOSH would like to see more multidisciplinary working in this way, more health and safety input to public policy, and more health and safety capacity building across the world wherever it's needed. So overall, organizations need strong leadership, worker engagement, and good health and safety advice in order to be able to protect the vulnerable groups. And these will include those at highest risks, like the health and social care workers and other essential workers. We need to think, as mentioned by you, Manal, the informal economy, who sometimes have to make the unacceptable choice between their health and hardship, and even worse, those in modern slavery, compelled to work and subjected to misery and danger. And there are those in the supply chains as well, responding to surges in demand, which, as we know, can lead to long hours working and shortcuts in health and safety. Now, underpinning all of this, IOSH believes in the need for evidence-based practice, which is why we're currently funding research by Turku University in Finland and the University of Leicester in the UK into hospital-acquired staph infections. This is from aerosol-transmitted pathogens, which is very timely and is due to report very soon. And it's also why we've partnered with the World Health Organization on a series of webinars on COVID-19 and have engaged recently in a survey of health and safety professionals across the world to gather their experiences during the crisis to help inform future guidelines and practices. But our bottom line is that no worker should lose their life from contracting a communicable disease like COVID-19 at work. And we're very pleased to provide support in this, and our free resources are available to all on our website at iosh.com/coronavirus.
Thank you so much. Thank you, Richard. And as you say, we want to prevent that sort, and there are discussions that this may even have started in live animal farming and markets, and the way safety and health actually measures are taken and adopted in these different workplaces could eventually prevent larger outbreaks, and the role is right there. I'm going to quickly go into the another question on how this, where control measures to be taken. How do we take into account our small and medium enterprises that may not have the necessary OSH resources? I'm looking maybe to Chris Davis on ideas on that. Thank you.
All right, Manal and everybody else, just a couple of thoughts real quickly. When we talk about strategies and policies, I think it's real important to remember that those need to be crafted under normal working situations, but also be designed to incorporate emergencies so that you're not dealing with that and not having to address emergency features when you're actually in the midst of an emergency. They need to be crafted collaboratively within a company, so all levels of an organization have ownership and are integrated into the business of the business, and not be a flavor of the week program that gets placed on the shelf after an emergency situation subsides. That's just very, very basic. With regard to OHS resources, I don't think it's any great secret that there is a shortage of them worldwide. There are probably more in the developed parts of the world as opposed to the developing parts of the world. So it's important to appreciate the fact that we are all responsible for safety and health. That includes operations managers, the business community, employees, organization staff, which includes QA, engineering, purchasing, and workers alike, and each have specific safety and health roles, which must be exercised daily and be prepared to function under tough circumstances. What is the enabler in all this? I believe it's learning and education platforms. Technology plays a big role here. Learning and education can occur from other small and medium business forums, trade councils, trade schools, governmental training centers, professional organizations, and universities. These are just some of them. But at the end of the day, education is a powerful enabler, and I think is something that everybody deserves and has a right to.
Thank you. Thank you so much, Chris. We need to answer a little bit more quickly to get through some of the questions that I have. Maybe Teresita, after listening to the different requirements also, is there anything that you are doing in the Philippines more targeted to smaller enterprises in this phase to support them? How do you get the knowledge? Knowledge and education is important. How do we reach these small enterprises? How do we consolidate between family work that is happening in farms, in small farms around the house, or small workshops? How do you get the message across also when people are all unable to practice physical distancing maybe, and the various measures that we are requiring of sanitation and access to clean water and others? What is your experience in the Philippines? Please go ahead.
Yes, okay, thank you very much. And actually in the Philippines, all of this have been considered, especially for the micro, the small. And in fact, to assist them, we already prepared programs for them, so that even if they're in the small, so that they will have amelioration programs, there are disinfection programs, that if they do that, they are paid. So, we are putting together an approach where they are going to have their social amelioration, but we're also looking at how they can best disinfect their place of where they live. Of course, it is especially for this where they work. But remember, we are on a lockdown, so there are only essential services, and that is why we are providing, and they have to be provided for in terms of cash assistance. And our information education campaign is there every day from our small unit of government, the barangay, and it is always being said. And actually, the local governments are pushing this so that everyone will understand the challenge of COVID-19, how to best protect themselves, and when we say it is best to stay home, we mean it, and that it should be followed. It is really a whole of society approach. It's looking at everyone doing its work, and for government to provide, because unless we provide for them, it is really going to be a challenge, because they need, of course, the food, they need money for medicines, and all of that had to be considered so that it will be provided as we are in, especially in our period of what we call quarantine or lockdown.
Thank you so much, Teresita. This is very informative. I'm going to quickly jump to Dr. Robertson Michelle to tell us a bit more. How do we manage the ergonomic hazards of work from home? And then I'll move maybe to Lode to discuss a bit about the mental health concerns for first-line workers and also for working from home. Michelle, please go ahead.
Thank you. I think what's very important is that we need to recognize there's physical and mental demands of working at home. We used to be able to work in an office environment with ergonomically designed chairs and workstations, and now we've shifted home. So we are in a position where the physical demands have increased. We may or may not have appropriate chairs that we can adjust to support our bodies. What I'm concerned about from a human factors ergonomics perspective is that postural load and static load for long periods of time without taking proper rest breaks, without changing and varying one's work postures. So we have to be creative in how we can use what is at our home. We can't order on Amazon because there's just the supply chain is kind of clogged because now everybody has moved home. So we need to have some creative ways that you can set up your workstation to support a neutral, optimal, relaxed posture. So we're not in awkward postures and straining our back, straining our neck. So it's important for us to consider what are some creative, insightful solutions at home, and a way to bring the team effort in, managerial support, as well as corporate real estate, as well as your human resources. We've all discussed the importance of a team coming together, communicating what are some insightful and creative ergonomic solutions at the home can be provided. If there was programs already existing with the employers, then that can be rolled down to the employees themselves through some kind of education program, online ergonomic assessments where the health and safety officers can help those employees at home. And then to bring in this issue of lack of social communication and connectiveness, I think it's important for us to have some problem-solving efforts where team members and employees can share their success stories of how they were able to overcome. For instance, using an ironing board to move into a standing position, using pillows, using different props to allow you to get into a properly sustained and comfortable posture. But on using problem solving on the aspect of the teams can come together. So not only you're having kind of a virtual connection, but you're also helping your other co-workers on how you can solve some of those physical ergonomic issues. Another important area is just not the musculoskeletal area. When we're looking, it's also the visual demands. when we're looking at lighting sources. We also have to be concerned about that visual demand on the eyeballs themselves. So the eyes lead the body. So we need to make sure that we are setting up those environments. We have some very good resources, one-page checklists that we can provide. They're on our websites. And the Human Factors Ergonomic Society of the United States has put together another webinar that is available to everyone to look at those. But I think we need to always make sure you're balancing and creating a dedicated workspace for you so that you know your boundaries, you know that this is where your dedicated workspace is. So that leads into also the mental health of this is my work environment where I'm working at home. It gives me a boundary to cue to my other family members that you're having, this is my work time, this is when I'm in my particular zone, and then setting up a time management schedule so the family knows when you're working and when you're taking those breaks. And at the very end, if it's possible, taking a walk outside and just getting some fresh air is very important, and that's healthy as well. So it's a systematic approach. We need to, what we call kind of prevention through design. And then we need to bring together kind of that social support for the different kind of technology uses that will help people get into an ergonomic posture, vary their work postures, stay connected, and do your work-life balance. And this is where we look at the system.
Thank you so much, Michelle. Obviously, these could be easily applicable for some, and these remain difficult to apply. People come from all sorts of backgrounds, have very small apartments,
yes.
Be struggling with different issues, of course, and cannot always be able to assign themselves a working place or time. People are juggling, and this is why we are seeing a lot of suffering. Of course, this is not equal to the suffering of those in the front line, but still people have different safety and health concerns in different work arrangements. Lode, maybe I move to you to discuss quickly how can we manage this? We know that our frontline workers are facing a lot of violence and harassment, mental stress, breakdowns, and those who are not possibly dying from COVID-19 are dying from other associated risks. How can we manage? What is your advice to them, and possibly also on mental health, on the various work arrangements from home or others that people are facing today? Lode, over to you.
Yes, thank you. I think for healthcare workers, the so-called white-collar workers, their mental health issues are mainly a result of the high workloads they experience during the crisis. And I think it's very important to provide support, mental health support from them. But I would stress that a lot of support can be delivered by colleagues and also by their supervisor. I think that's the first line support. There's most evidence for that's effective. A second condition is that provide them with the right protective equipment, create good working conditions, because the insecurity of dealing with sick patients and having a fear about being affected yourself has a heavy weight on their mental health. So creating good working conditions is also an important factor in the prevention of mental health problems. And a third part I would like to mention here briefly is that, if you look at the healthcare workers, I expect I would like to claim that they need some time to recover from this period. And that will be a difficult task, because at the same time, expect that healthcare services and hospitals will be pushing for a return to normal operational levels. And I really would like to ask hospitals and healthcare services to take this into account and make a rotation within the teams. So that's for healthcare workers, I think, very important. The second group of workers we need to consider is, of course, the white-collar workers, that most of them are doing telework. There, the combination of work and home interference is quite important. It's not so evident to focus on your job while kids are running around. And I think there also supervisors and employers can play a major role in recognizing at these difficult times that it's not evident to provide work and to deliver as expected, and also think together how about systems, about schemes that can be implemented so that that combination can be made feasible. And also for these workers, once we are getting out of the lockdown situation, it will be quite important to provide support and to prepare them to return to work. I think being away for such a long period from work, that induces some insecurity about how work will look like and how it will be. And so it's better as to talk about it, to talk about the measures that will be taken, and to have to take decisions together, employers and employees, about the measures that need to be taken. And please also talk about the insecurities and the fears. And a final group of workers concerns a big group of people that already lost their job or have experienced some severe cuts in wages. And I think for those workers, we really need to make investment and guarantee that they can get back to work, because getting back to work is very important for the mental health of a whole population. So that's a third specific group that we really need to reach out to them and do everything what's possible to provide them with a safe job.
Quickly, while I have you, there was a question that we received also that for some people it's not possible to comply with lockdown. Some people get paid per day. They do continue to go out to work. How do we protect these people? What securities can we provide them as they are locked down and as the lockdown is elevated, etc.? Are there any advice that you may give to such workers?
Yeah, I think it's what we know from previous pandemics, is that if you want workers to comply with the measures and the quarantine measures that's being taken, you need to guarantee some kind of job security. I know that's not evident in a lot of countries, but that's really what I would like to ask to employers and also to ask to governments. That's really what works. So it makes that people can comply with the measures and also have some kind of job security. So guaranteed jobs and job security is difficult in these times, but it's necessary, especially for this group of people. We also need to be aware that those people work to live and to survive. So we need to provide them with food, consider subsidized wages. And if they get back to work, please provide them with the appropriate personal protective equipment. I think as employer, please give them, and not only just give them the PPEs, but also train them in the use and maintain them. And we know that from previous recessions, if governments decide to invest in social support measures and also in helping people to get back to work, that you really can decrease importantly the burden of mental health problems in a society and prevent for example, deaths due to suicide. So it's really invest in safe work for informal workers. That's my main message here.
Thank you so much, Lode, which takes us to our
Manal, can I add something to that?
Yes, please go ahead, Chris.
Yeah, what I think is also important, that is our societal response to all of this was not always very well coordinated, and a lot of the measures were not very well thought through. So before we end up giving people compensation or financial support, we should have, in the first place, have organized our lockdown measures in a better way. Some essential services were considered essential, but the workers were not allowed to commute. Some were considered not essential until somebody discovers, oh, but the hospital cannot run if we don't have that product. So that is the biggest vulnerability. Our society was not ready. Our response capacity in a coordinated and organized way was not optimal. And so we could have reduced the number of workers sitting home or not having income by better aligning our measures. Sometimes in a lot of workplaces, it's easier and better organizable to organize the distancing than the people staying at home. And that is where everything is connected in the end. So I think societal response, the coordination, what is really essential, how you organize this, how you take care of your workers, how you do you take care of the home situation, all of that better coordinated and better thought through. And that is where the bottleneck, the real bottleneck is.
Thank you so much, Chris. That's very true. I'm going to move into a last couple of questions, and I'll give a moment for everyone to just give any other insights they may have as we proceeded with the discussion. Talking about return to work, so this is what many countries are talking about, and eventually other countries, some are still talking about eventual lockdowns, but some are already discussing and preparing for a return. There's a big threat here, as we can hear. So the threat of going into another surge of pandemic is something everyone wants to avoid. How do we ensure that workplaces are ready? And what kind of return to work are we talking about? Maybe some preliminary thoughts from Richard, and maybe Barry or Teresita, if you want to come in on the issue generally of return to work. And then I wanted to ask Michelle or others ergonomically. We received some questions about companies who've set up their workspaces as activity-based so that people rotate between desks. What does that mean when we are implementing physical distancing? So I'd like us to talk a bit in not in detail, we don't have too much time, but really what are the specific measures? There are so many practices out there in terms of temperature taking, mask wearing, physical distancing, one-way hallways and one-way staircases and all of that. Really, what is practical and what are we really looking at as priority measures as we return to work? Richard, please.
Thanks, Manal. This is about initially following national policies and ensuring that risk-controlled easing of restrictions depending on the COVID-19 situation in the different countries, and to make sure there is a safe transition to the new normal, whatever that might be, which I think will involve, appropriate physical distancing and perhaps a period of moving in and out of lockdown measures, but whatever is needed to avoid a resurgence of the disease. Now, this requires organization leaders to plan, organize, and monitor a safe return. They need good health and safety advice and worker involvement as part of joint teams to assess and manage the risks. They need to keep themselves up to speed with the national rules and may also access further guidance from their health and safety regulators and trade associations. They should provide COVID-19 awareness training and also ongoing medical health support. They may need to redesign their processes to allow for safer physical distancing and improved ventilation, for example. And this will need to be tested fully before full resumption is assumed. On hygiene, they may want to increase their signage and facilities and the systems for hand and respiratory hygiene. And of course, workplace cleaning, this needs to be regular and thoroughly done. And where they've had premises or equipment mothballed during the lockdown, they'll need to inspect them thoroughly to ensure everything is safe for recommissioning and for workers to return, and to remind everybody of the safe working procedures. There are issues around working time. They may need to stagger start and finish times to reduce the social crowding, particularly around tea breaks and lunch times. And they may require fewer staff to be on the premises than previously, so having some working from home or remotely. But I think the important and override principle is that health and safety must come first.
Thank you so much, Richard. I don't know if Michelle, you want to add a bit about how can we implement physical distancing with these different work arrangements that we've been advocating for from landscape. Please go ahead.
Yes. Yes, how we've shifted into, thank you, how we've shifted into work-based activities. I think we are going to have to kind of take a step back and reshift. An important message I think that Richard was bringing up is the stakeholders. We need to bring in our corporate real estate individuals, environmental health and safety, human resources, legal, bring in an employee representatives to make sure that we're working together as we move back into offices. I think a couple key areas is going to be the communication from senior leadership about we have a new way of working here. We want to support work-based activities. However, I think we're going to have to reduce the density of the design itself. We may have to consider every other seating workstation and use some other dedicated areas that were primarily for conferences or small huddle rooms, other areas that could be also seated or standing work areas. So it's going to have to be a blend of bringing in, still supporting the workers' needs, but having them being part of that communication, part of that participatory approach and involvement is that it may have to be more dedicated into a particular activity so that you can reduce that density, have the safe physical distances, and then the whole cleaning process and communicating that cleaning process. We may have to have shifting, so workers may be coming in for 1 week and they're working at a particular work-based activity and then moving to another, but we can also start kind of tracking who is working where and reducing that physical density. It's also going to have to be looking at how do we balance what they're doing in their job and also making sure that we're still doing ergonomic assessments, occupational health assessments, and setting up those physical work environments where people feel safe. Because there's also so going to be that mental anxiety if I'm back in an open environment. Is this environment safe for me to work? So there's going to be needing to have some reassurance through that communication, understanding when those cleaning processes are going to occur. They're being trained on this. So it's a shifting and balancing with the density as well as the flexible workspace, but it can be done. And I think with the interdepartmental relationships and bringing in your key stakeholders, it can be addressed in a very positive manner.
Thank you so much.
It's Barry.
Yeah, please go ahead.
So we took a different approach to the process. The micro environment I'll come to in a minute, but we took a macro policy environment. The macro policy environment is led by the president. It brings together a risk-adjusted framework tool, which brings together macroeconomics and accounting, social factors like poverty, etc., and then epidemiological factors. So it brings health factors, social political factors, and macroeconomic and macro political factors. So, and we've got data that feeds that issue, and then we've graded the country into 5 levels. Level 1 being open society, level 5 being totally restricted society. So we've now moved from a level 5 to a level 4, and we're due to reopen the country then in terms of the level 5 to level 4, and this was the risk matrix that was put in. In terms of the facilities themselves and the risk, it's quite important because we have what we call clusters of cases at the moment. So South Africa isn't at the level of the epidemic curve as with some other countries north of us or in Europe or the United States. So we've got certain issues that you take in terms of geographic, urban, rural, density, issues around cases and clusters, and then the issue about how do we open up the economy by sector, by workplace. So we have prepared what we call a facility readiness tool for a workplace to meet. And part of that was regulations under the National Disaster Act by the Department of Employment and Labor, which manages the Occupational Health and Safety Act. So we have a policy framework and we have a legal framework that we have to work with in terms of this. And within that legal framework, we have segmented the industries into greater than 500 employees, 10 to 500 employees, and less than 10 employees. That covers the SMME sector. There are dynamics around the informal economy, but leave that for now. So in terms of greater than 500 employees, they have to have a policy, plan, and a risk assessment done, and it'll have to be written and reported to the Department of Employment and Labor. For the rest of them, they have to still do a risk assessment, but they do not have to report it. So there'll still be an inspector that would come and look at it, and they would have to look at that. And those are factors then that takes into account various things. So we have a workplace readiness tool, which is just 5-liners that they tick and say that they're ready. That means, do they have the policy? Do they have the chief executive sign off on a corporate charter to keep the workplace safe in terms of COVID-19? Do they have a risk assessment done, etc.? Then from the workplace readiness tool, we will have a workplace monitoring tool. Once a week, they will have to fill in certain data on the functioning in terms of PPE, on any risks, on any COVID positive persons found, etc. We then have a symptom screening tool, because at the moment we're going for symptom screening, and these are all online tools that we are implementing in South Africa, noting the nature of it, that we can do these online tools. And from symptom screening, we go to targeted testing, and then based on the targeted testing, whether they are positive, how they are managed, and if they are negative, how they are managed. The risk assessment tools, we have risk assessment guidelines that are done in terms of occupational hygienists and what are called designated professionals in terms of the act. This is the highest level. We then have risk assessments done by health and safety reps at the coalface. These are very simple tools that allows health and safety reps, particularly the trade unions, shop stewards, etc., in terms of working through this process bottom up. And thirdly, we have a worker risk assessment tool where the worker himself can answer 10 questions and says, do I know about COVID? Do I know about PPE? As the management told me about things. And if there's any of them that's a stop, it's a red green. If any of it is stopped, then we say talk to your supervisor. So these are simple tools we put in. We're setting up an extensive education and training program online, and we're working very closely with the trade unions in terms of the bottom-up approach. Thank you, Manal.
Thank you so much, Barry, for this concrete example of how your government is managing the issue. And this is, of course, adapted to different contexts and different economic, socioeconomic situations of various governments. As we are approaching, I see, Teresita, you have your hands up, but maybe I can ask a final question, and this will be the moment for you to come in with any additional comments. What I would like to just get insights from you on is, so what have we learned really up till now from the OSH world, from this pandemic? How best can we anticipate a future management crisis, I'm going to call it, when when this happens without any previous announcement, etc. What are your general thoughts? If there are discussions that had happened and you had input on them, please go ahead and make some final remarks, and anything that could help our audience learn more about the situation we are living in. Maybe I could start with Teresita. Please go ahead.
Thank you. There are so many unknowns in COVID-19, and we realize that. And in fact, in many of the decisions, we always start with what do we know, and we end up with we do not really know everything. But okay, we are starting to open up. And this is where I just wanted to share, like from the Philippines, when we say we're opening up, but we cannot open up and we cannot be that everybody comes in. We start looking at the segments of who can then come in. We remove the vulnerable sectors, we remove those 60 and above, we remove those who are with comorbids, but they will work. They will work because there's work from home. And this is how we're approaching. And this is still safety and health because we are looking at preventive measures. And like I said, and I will start again from where I came in, no cure, no vaccine, then prevention will really be the way to go. And we have to analyze, and this is where all of us will come in and bring out what are the preventive measures that we have all been taking, what is working. I know that industrial hygiene, there will be many assessment tools that will help, and we look forward to that. But for now, we still are looking at, and we are going to appreciate anything that is coming out. And from our end, we can also share what we are doing so that we are still preventing the cases to surge. We are trying to bring down cases, and we are really trying to beat COVID-19. So with this, again, thank you for inviting us, and we look forward to future collaboration and cooperation so that we can really address this problem where we have to face it, on a global, multi-sectoral kind of approach. So thank you.
Thank you so much, Teresita. We are approaching the end of our time. I'm going to go to Chris for final remarks. Please go ahead. And thank you so much for joining us at such an early time in San Francisco. Unmute, please.
Well, you know, in terms of lessons learned and just something to hope for the future, I'm a big believer in learning technology platforms. I mean, we've all been moving through this. It's still a long journey. This is not going to finish up and wrap up in a month or two, but it's critical to have the appropriate skills and resources. And I think learning technology platforms can be a big enabler, whether they're professional resources or frontline worker resources or community resources. They all need to come together. Another important feature is understanding the roles of global governments and organizations and those that the community and the regions can assume. And there is a role for both. Global organizations that can benefit everyone, global supply chains for PPE, ventilators, chemical reagents, and they play a critical negotiating role so that we get the best in the competing markets. In terms of scientific understanding and learning, that ought to be shared globally more seamlessly than we've seen up until now. It's getting better, but I don't think it has to be such a struggle moving forward. And the only thing I can say is, you know, we struggled with all this initially. We shouldn't let it happen again. We'll have another pandemic. We'll probably have several more. We can't do this alone. There's an old proverb that says, if you want to go fast, you go alone. If you want to go far, you go together. And together we must, all of us.
Thank you so much, Chris. I mean, which also brings us to Chris de Meestre's point. A lot of decisions were made quickly without thought of the whole supply chain that is affected by every decision, or the whole chain that is needed to actually get a restaurant running or stopping, and how it affects the whole wave of businesses. Maybe, I don't know if Silvana, did you have any impressions now that you've heard the discussion? Is there any last point you'd like to make on behalf of the work? It's up to you.
Yes, thank you. I have just two final remarks that I would like to raise. One is it's clear that this crisis now is at a very crucial point, and we cannot address repeating some mistakes which were done in the past. So a fiscal reform is needed because we have to invest in the public systems. One of the main problems in the countries, in all the countries where the problem of the COVID has exploded, was the lack of intensive care unit, in not enough doctors, not enough nurses, and this was done because of the cutting in the past years. This cannot be repeated. So a massive investment, and a massive investment recuperating all those taxes which were evaded in the past years must be done. The system of the global supply chain, for instance, has allowed a lot of tax evasion. So taxes must be paid where production is done, and the system of the fiscal havens, the system of exemptions should be fighted in order to protect the community and the collectivity. The second thing that I would like to say is this, that all the scientists now talk about still some waves of the virus in the future times. Even in the country where it seems now to be under control. So it's important now, it's important like never, if possible to be said, that occupational health and safety is a key point. And as Teresita was saying earlier, the point of the prevention, so of the elimination of all the possible risks in the workplace is absolutely needed. So it demands a different organization of the work and a different system in the public transport, in the physical distance, and so on. This can be done only if it is done in accordance with workers' representatives in order to get the best solution, because the vaccination or the treatments do not seem to be exactly very close. So in the meanwhile, we have to protect, because there is something that we should avoid. To have two classes of people, those who can be confined and the others who have to go to work in the possible situation. This is absolutely to be refused. And this is the message that we have to launch in this day for the International Day for Protection of the Health and Safety of Workers.
Thank you so much, Silvana. These are very important inputs, and these inequities are something that globally countries are trying to struggle to address. And maybe I will move very quickly. We are really running out of time. Richard Jones, just any final comments? I mean, it's really, especially for those who did not get a chance to say really some urgent issues that they wanted to express through this webinar. Richard, please go ahead.
Okay, thank you, Manal. Yeah, I agree with Teresita. This is a new virus and a new challenge, and we're still all learning about it. So we need to gather and analyze data, share experiences, and reflect carefully on what the best approach is. But I think some of the givens for such global emergencies, we need better global coordination and more vigilance and earlier triggering of national and corporate emergency plans, which should also include testing, contact tracing and quarantining, and vitally the strengthening of health and social security systems and ensuring better training and protection of frontline staff. Governments and employers need to work together for societal good. While for future planning, there should be a focus on health and safety and public health professionals working more closely together in developing and sharing best practice for the different situations that stretch across the globe. Thank you.
Thank you so much, Richard. Just final words, Michelle, followed by Lode, and I'll get to Chris de Mister after that. Michelle, please go ahead.
Thank you. I just would like to echo and support many of the observations and comments the previous panelists have said. I think we're in a continuous learning phase. We need to bring in local stakeholders as well as employers, as well as governmental stakeholders. It's a continuous learning process. We need to share our success stories. I think we also need to learn how we're going to be phasing people back in to another type of work. And I also say, I'd just like to really echo the importance of learning technology. I think communication and using different ways of reaching out to employers and employees of how they're going to work together and bring in the other key stakeholders. So we're all monitoring, we're all learning so that we can share these success stories. Thank you.
Thank you so much, Michelle. Lode, some final remarks, then quickly Barry, and then I move to Chris de Mister. Lode, please go ahead.
Thank you. What I would like to recall from the pandemics is also the good things, how we managed in enterprises, how to deal with these issues and fastly move to a new way of working, which allows us to work in a safe manner. And I think I'm quite impressed by the speed in which both workers and employers have managed to do this. And I think with these lessons that we learned there, I think especially we have to keep in mind and now use in the post-corona crisis to keep on thinking how we can improve working conditions and also learn to think out of the box. Especially home working was maybe not the standard, but you see how fast things can move, and I'm convinced that home worker will become a new norm, will become a new standard. So let's stay positive, look at the solutions, look at the bright sides of life, learn from it, and especially the solidarity that we all have experienced in these intense periods. Let's keep this solidarity and use this to improve working conditions for all workers.
Thank you so much, Lode. For some of us, this means we need to be buying bigger houses to afford offices and managing children and others at home. But yes, it may become the new norm where we would be working remotely. I'm moving to Barry. Please go ahead.
Thanks. So one of the things COVID-19 did, besides health systems interventions, is it put occupational safety and health in the forefront. So let's build on that, because OSH is critical to managing the preventive protective of workers, and let's move on that, particularly through GOSH, ILO, WHO. The second issue is I've not had any discussion on a global compact on personal protective equipment? Can we get the multilateral agencies to pull an urgent global compact so we're not competing in terms of who can buy the most expensive hazmat suits, etc. A lot of it is prevention. So the global compact is needed urgently. The second issue, we need to stimulate local manufacturing and transfer technology free of charge to low and middle income countries. A lot of the PPE can be done through simple interventions. Can we do transfer technology, the making of ventilators, the making of CPAP machines, etc.? And can we start sharing resources from the north and the south, the east and the west in terms of these issues? So that global compact. The third issue is recruitment of health staff. Can we move also on a global compact on recruitment of staff so that we can actually ensure that low and middle income countries also have the health staff to also manage ICUs, etc., while we are dealing with the issues of the top. So those are some of the issues in terms of that. And just to point out that one of the vulnerable groups that we should just watch out for is migrant workers, that we didn't discuss in this thing. There's a whole lot of vulnerability, but migrant workers almost sit in a no person's land in many ways in terms of things. Thanks, Manal, for a very interesting webinar.
Thank you so much, Barry. This is really informative, and it really reminds us of where investments should be made. If we don't have our health, we really can't do much. So, and a lot of cuts globally have happened to the public system, as Silvana has made, and to the health system specifically. And OSH is part of this health system, and investments should be made there, and knowledge should be made available for free for everyone, and to collaborate. Chris de Meester, you're the finale before our branch chief.
Thank you, Manal. What I have learned so far, what I take away from this crisis is that all of us, workers, employers, and us as citizens, that the majority of us is really very disciplined, that we are very responsible, and that we have a good common sense, and that we will make it through this crisis, despite sometimes chaotic, uncoordinated, and not well managed government responses. It will be because of the people that we will make it through this crisis. And what you see behind me now is the result of creativity and collaboration between people. It's just a floor plan of a factory showing all the possible measures you could take to reorganize the work, to put physical barriers, to put extra sanitation, to put circulation plan. It gives you in one view all the possible options there are, and that's the result of creativity and collaboration between workers, employers, and other creative people, and that's the practical approach. So that is what I take away. And before starting to investing massively in public institutions, we also have to ask us the question, why were they not ready? Why were their readiness and emergency plans, where were they not in place? Where did they fail before massively investing? And I'm not talking about the individuals who did and are still doing a great job, but the systems and the coordination should be optimized before further investing. My advice to policymakers is draw the frame. If it comes to work and working conditions, just draw the frame, set the minimal conditions, and leave it to the social dialogue and the collaboration between workers and employers at the workplace to find out how exactly to do it. If you impose things from the top to the bottom, it will always be suboptimal. And for me, that's a last message to Lode. For me, telework will certainly be part of my working future. But unfortunately, a result of a recent survey we did, a lot of workers are completely fed up and tired of the telework and would like to see their colleagues in a real physical place. Thank you all for listening. Thank you for letting me contribute to this World Safe Day. Take care, stay safe. Thank you.
Thank you so much, Chris. And maybe teleworking won't be so bad when public spaces open also again and people are able to socially see each other outside of workplaces as well. But this has been an excellent panel. I will move our just quickly to say we cannot underscore the importance of occupational safety and health to save lives today. And we're happy to have this World Day as a stepping stone for future discussion. And I think there are going to be plenty of discussions as we evolve and learn more and how to do this together. I'm proud of our workers, our employers, our governments, and all of you have joined us today for this very rich discussion. Joaquim Nunes, over to you.
Thank you very much, Manal. So first of all, I'd like to thank all of our panel members and all of our participants for being there with us. I think this was a quite interesting and comprehensive dialogue on how COVID-19 is affecting all of us. And also, I mean, potential answers that countries and enterprises are really putting together to address this particularly challenging issue. I think also building on what Lode said, and also I think also, you know, to a certain extent, Chris, to end on a positive note, I think, you know, what this crisis leaves us with is, you know, the solid understanding that OSH is a good investment. So it's a good investment for countries, it's a good investment for organizations, it's a good investment for enterprises, it's a good investment for workers. So also this crisis showed us, you know, the many vulnerabilities that we have in terms of responding to crises, in responding to pandemics, and the vulnerabilities we have not only well, at national level, but also when it comes to the mandate of each different organization. It also has once more revealed that, I mean, for us to tackle the issues successfully, we need, first of all, to have a multidisciplinary, and for the ILO, I think this is quite important to stress, a human-centered approach to the pandemic. Also, what we have seen here, and this is nothing new for all of us that work with Occupational Safety and Health, I mean, the approach is to prevent. It is to, well, the situation is evolving at different speeds and, you know, at different levels in different countries. And of course, what we have to do, you know, in our different roles is to anticipate this change and to try to anticipate this change, as I think Richard was saying, with the evidence that we have available. And it's only with evidence that, you know, we can develop the most appropriate policies, you know, to address this topic in countries and also going down, you know, to the level of the workplace. So again, I'd like to say that also we heard here, I mean, on how important is social dialogue and how important it is for workers and employers to address this pandemic, bringing, you know, into the dialogue, you know, the experience, but also the needs that both the employers and workers have in terms of addressing the crisis from a NOSH perspective. And then again, thinking of all the workers, thinking of workers such as we are, you know, most of us working from home already for, you know, some weeks, thinking of the workers that are still out there, you know, working on an everyday basis, you know, on the workplaces that are open and the workplaces that will reopen now that countries, you know, are planning, you know, to go back to the new normal activity, but also thinking very much, and I'd like to finish with this note, thinking very much of the most vulnerable populations, because when the crisis and when the pandemic gets there, it may be a catastrophe, you know, and I think, you know, we all have responsibilities there. And again, I think, well, globally, it is something that we do need to address. And of course, I'm referring here, you know, to the workers in the informal economy. I'm referring here, as Barry said, you know, to the migrant workers. And I'm referring here to, well, workers involved in occupations such as domestic workers and others. So again, I'd like to leave you all, you know, with an invitation to visit the ILO's website and to see all the materials that were developed for Safe Today, but also, you know, other materials that, you know, were developed in relation to COVID-19 in general. I left you here, you know, on the chat box, the link to the webpage where you can find all of these materials. And once again, I'd like to thank you very much for being there. And we are here to work with you. And I'm sure, again, to end on a positive note, that this crisis, you know, will end one of these days, and hopefully, you know, as fast as possible with the joint efforts of all of us. So thank you very much.
Thank you so much, Joaquim. And again, we apologize for the thousands of viewers who wish to enter Zoom. I'm receiving messages everywhere and who then ended up following us on YouTube. We apologize, but we did not expect this level of attendance. Thank you so much, everyone. And we may leave the meeting now. Thank you.
Thank you.
Thank you.
Bye-bye.
Goodbye, everyone.
Bye-bye.
Thank you. Good night. Bye-bye.
Goodbye and thank you. Goodbye.
Thank you very much.
Mhm.